Hi friends, welcome to Plexus Ortho. My name is Dr. Kanan Kumar. I'm an orthopedic consultant, and today we're going to discuss the MCQ number 225 that we put up a couple of days ago in the Telegram channel. So the question was, direct or primary bone healing occurs in which of these fixation? So remember, so look at all these terms. What is direct and what is primary, right? So we will discuss this in a little bit more detail in the following slides. Okay, so among all these options, lag screws was the best answer for this question. Okay, let me go through why lag screws was the best option for this. Okay, so primary or direct bone healing is when you get rigid fixation. So the fixation is so rigid that there doesn't have to be all the stages of fracture healing. What are the stages of fracture healing that you know of? The stage 1 is stage 1 of inflammation. Stage 2 is hematoma formation. Stage 3 is soft callus formation. Stage 4 is hard callus formation, and stage 5 is remodeling, which takes over a period of years. So stage of inflammation and hematoma formation may be from 5 to 14 days, right? Then you have the stage of soft callus formation. Then you have the stage of hard callus or modeling, right? And then you have the stage of remodeling, which takes years of time. So these are the stages that a secondary fracture healing process take place. A direct fracture healing is where all these processes are bypassed and direct Haversian remodeling takes place. That is, bone growth occurs directly between the fracture ends, right? So this happens when there is very close approximation of the fracture site, when there is solid rigidity of the fracture and the fixation is so solid that there is no movement and there is good opposition. So this is called as primary or direct bone healing, which does not go through the various stages of fracture healing, right? So this happens when the strain is less than 2%. What do you mean by strain? That is the movement, when there is some pressure applied on that area, the movement is very minimal, that is less than 2% movement occurs, right? So that indicates that the rigidity of the fixation. So if strain is less than 2%, indicates that they can have a primary or direct bone healing. Okay, this happens in intramembranous fashion, right? So this kind of healing is called intramembranous healing. Okay, and this happens in absolute stability constructs. What are the examples of absolute stability? We have this lag screw, right? So we have a fracture like this. So if you pass the screw perpendicular to the fracture site, and as much as possible, of course it may not be geometrically possible many times, but pass it as perpendicular to the fracture site as possible, this is called as a lag screw. What are the other principles that we use to fix the lag screw? One is that the proximal drill hole must be over drilled, the distal drill must be under drilled, right, or appropriately drilled. So therefore when you have a fracture like this, when you over drill the proximal hole and under drill the distal hole, when you tighten the screw, there is good compression in the fracture site. Okay, and this is called the lag screw phenomenon, or the way the lag screw works. So lag screws are provide absolute rigidity to the fracture. These are one of the cases where, one of the conditions where you have primary or direct bone healing. The second one is the DCP, or dynamic compression plate, where you have absolute rigidity and you have compression of the fracture site, good approximation, good stability, and therefore they heal by primary healing or direct healing. So in these cases you will not see a callus formation, right? Callus formation indicates a secondary bone healing because it is going through all the phases of fracture healing. Okay, the second method of bone healing is called a secondary bone healing, which occurs through endochondral healing. That is, it goes through all the phases: stage of inflammation, hematoma formation, soft callus formation, hard callus, and remodeling. These are the various stages of fracture healing. So this happens when the strain is more than 2%. So 2% to 10% of strain is present. That is, there is some micromotion in the fracture site, right? For example, like an intramedullary nail or an external fixator, there will be some micromotion in the fracture. In many cases, this may be helpful also because this stimulates bone formation, right? So when you have some micromotion in the fracture site, the strain is between 2 to 10%. The bone heals with a large callus formation, and this is called a secondary bone healing, right? And if the strain is more than 10%, the fracture fails to heal and it goes on to become a non-union. So which are the conditions in which secondary bone healing or endochondral bone healing occurs? It occurs in non-rigid fixation methods. So for example, Cast application is a non-rigid fixation because you're not rigidly fixing the fracture site internally. So therefore there is some micromotion in the fracture site and can cause secondary bone healing. Okay, any kind of external fixator, including Ilizarov fixator, including uniplanar, biplanar, external fixator, any external fixator that is used for open wounds, deformity correction and other such indications, always heal through a secondary bone healing. Okay, intramedullary nailing, any nail which passes through the medullary canal, like the tibia intramedullary nail, in this case it is a PFN or a proximal femoral nail, all these conditions heal with secondary healing and not primary. Okay, buttress plating, right? So for intra-articular fractures or peri-articular fractures close to the joint, when you put a plate in a buttress fashion, so you support the fracture site with the fracture fragments with a plate like that, then it heals by secondary intention because it is not rigid fixation and we are only supporting the fixation. And so these cases are where the secondary healing occurs. So what are the secondary healing cases? Examples: cast application, all types of external fixators, intramedullary nails, and buttress plate. Why these heal secondarily? Because the fixation is not rigid, the strain is between 2 to 10%. Okay, however, if you have rigid fixation, like in case of lax screws or DCP, they heal excellent, and this is called as primary healing, which do not go through all the phases of fracture healing. Okay, so my name is Dr. Kannan. That is in brief about primary and secondary bone healing, and this is Plexus Ortho. Thank you very much.